I got into service in 1980 in the United States Air Force.
I was in the Army, military police, sergeant.
Staff Sergeant, United States Air Force, and I'm retired.
I was in the military for a combined total of about 11 and a half years.
I was an ammunition weapons specialist.
I joined the United States Marine Corps in February of 1974.
I was United States Army. My specialty was a 63 Bravo light wheel vehicle mechanic.
It was 50 pounds of HME, and it blew up right next to my truck, almost within a foot of where I was sitting.
I had heart issues. I had cardiovascular disease.
And they said, yes, you have a severe hearing loss in your ear.
I was in a helicopter crash in central Afghanistan, which paralyzed me from the chest down.
And in 2005, I had my first heart attack of 3.
If someone said, well, you were in the military, you can go to the VA.
It took a lot of courage for me to admit to myself that I needed help.
My thoughts about the VA prior to me using it were pretty much non-existent. Never in a million years did I ever think that I would be using it to the extent that I am today.
I knew that the Veterans Hospital was supposed to be there to help me and to assist me.
Years ago, I would not have gone to the VA because the VA had a very bad reputation. There's been a transformation in what the VA should do for the people who serve their country, and it's made a huge difference.
Integrity means that you take your job seriously, that you really care about the veteran, that you're not just there getting a paycheck, that you really like what you do and you really care.
The integrity that each doctor carries with them as far as wanting to get the job done correctly, it's refreshing.
If you as a provider can go one-on-one and they listen to what you're saying because they have the trust in you, it makes a difference.
Commitment. I learned that in the military. At 17 years old, at 18 years old, commitment, you follow through. So when I go to the VA and my doctor says he's going to do something, I don't have to wonder if it's going to happen.
Hi, Jamil.
We have various clinics like mental health clinic, GI clinic, eye clinic, a dental clinic. They're all committed to provide the very best care to the veterans who come.
Any problems that you have, they will listen to you, and if there's something that they can do, they'll do it.
My doctors, since day one, have been committed to getting me the things that I need, to making sure that my needs are met, to make sure that I'm getting the medications that I'm doing.
They are very much an advocate, not just for me, but I think all veterans.
It is very important to have an advocate inside the VA system. They strive to get you the things that you need.
I actually have a patient advocate on speed dial. She's almost family. First day I was in the hospital, she came and saw me, and she's amazing.
I love the fact that whenever I ask a question of them, they're willing to give me that little bit of education.
Treating you with respect. That was missing before as a veteran. You were not getting the respect.
All the nurses and doctors, what they deliver, it's about respect. They treat you like you're a patient, but it goes beyond being patient. It's just like being a friend.
They respect the patients and who comes in because they realize they're people too.
When I do tell them, hey, I am a United States Marine, I did serve my 4 years, they respect that I went in to protect their freedoms.
Excellence is a level of competence that we all try to achieve. And the measure of it is how we achieve it and what we perform.
Thank you, sir.
I see the kinds of things that the VA is doing to make the VA better. Everything from their inspection scores to the improvements around the hospital, they're striving to reach excellence every day. From their nurses to their cleaning staff to their executives. Everyone tries to make the VA a better place.
Not only is this a good system, but they pay attention. And I am a vet, and I'm special in that arena. And I fell in love with the system.
It's something I would recommend to everybody, is a vet, no matter what you are, no matter what era. It's worth it.
I'm very grateful that there's a VA medical center in any place that you can have the privilege to go to take care of yourself.
I feel that camaraderie when I walk through the doors, and I just feel like I'm part of something.
It's about treating you the right way, the way that I, as a veteran, want.
The VA has been good for me. They're still taking care of me to this day, and it works.
They're a top facility. Patient care, equipment, attitudes, treatment, it's just all top shelf. You're not a number, you're a person, and they care.
Someone asked me, why are you going to the VA? I said, I'm telling you, it's changed. I chose to go to the VA because when I went there, the service and the honesty that the people gave me, the treatment, was just fantastic. And if I'm getting good service with good people who care, I'm going to do that.